This chewable tablet is a combination of vitamins, iron, and fluoride and is used by children to treat or prevent deficiency due to poor diet or low levels of fluoride in drinking water and other sources. Vitamins and iron are important building blocks of the body and help keep you in good health. Fluoride is used to prevent dental cavities. It is recommended to take this tablet as directed by your doctor, usually once daily. It is best to take it at the same time each day to help you remember. This medication may be taken with food if stomach upset occurs. When giving this medication to your child, make sure they chew it thoroughly and swallow as directed by the doctor, usually once daily after brushing their teeth. If your child has trouble chewing and swallowing the tablet, consult the doctor or pharmacist for advice. It's best to take this medication on an empty stomach, either 1 hour before or 2 hours after meals. If your child experiences stomach upset, they can take the medication with food. Avoid giving them antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can decrease its effectiveness. The fluoride in this chewable tablet can be directly absorbed into the teeth during and after chewing, as well as being absorbed into the body from the stomach. It's recommended not to eat, drink, or rinse the mouth for 30 minutes after taking this product. Make sure your child takes this medication regularly to receive the most benefit from it. To help them remember, give it to them at the same time each day. It's important not to give them more than the prescribed dose. It's important to note that there may be some common side effects when taking Pediatric Multivit No.175-Fluoride 0.5 mg iron 10 mg chewable tablet, such as stomach upset, constipation, or nausea. If these effects persist or worsen, it's important to seek medical advice from your doctor or pharmacist. Iron in this medication may cause your stools to turn black, but this is not harmful. If you notice that your teeth have become mottled or stained, it's important to inform your dentist or doctor, as this may be a result of too much fluoride. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. While many people do not experience serious side effects, it's important to be aware of the possibility of a rare, but very serious allergic reaction. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Lastly, if you experience any other effects not mentioned here, it's important to contact your doctor or pharmacist for further advice. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to keep this chewable tablet out of reach of children, as accidental overdose of iron-containing products can be fatal in children under 6 years of age. If overdose occurs, it's important to seek medical help immediately or call a poison control center. This pediatric multivitamin with fluoride and iron provides essential vitamins and minerals for children's growth and development. The recommended daily dosage varies depending on the child's age and individual nutritional needs. It's best to consult with a healthcare professional to determine the optimal timing for taking this chewable tablet. Before giving this chewable tablet to your child, make sure to inform your doctor or pharmacist about any allergies your child may have. This product may contain ingredients that could cause allergic reactions. It's important to discuss your child's medical history with your healthcare provider before starting this medication. It's also important to note that this medication may contain aspartame. If your child has phenylketonuria, PKU, or any other condition that requires them to limit or avoid aspartame in their diet, it's crucial to speak with your doctor or pharmacist about using this product safely. Before your child undergoes any surgeries, be sure to inform their doctor or dentist about all the medications and products they are using, including prescription drugs, non-prescription drugs, and herbal products. This product is specifically designed for pediatric use and is not typically used by adults. It is also unlikely to be used during pregnancy or breastfeeding. If you have any questions about whether this product is suitable for your child, consult your doctor for guidance. As always, it's essential to follow the recommended daily dosage and to administer the chewable tablet at the optimal timing as advised by your child's healthcare provider. It's important to be aware of potential drug interactions with Pediatric Multivit No.175-Fluoride 0.5 mg iron 10 mg chewable tablet. This includes the possibility of it interfering with your body's ability to absorb certain drugs, especially if taken at the same time. These drugs include levodopa, quinolone antibiotics, tetracycline antibiotics, thyroid medications, and drugs for osteoporosis. It's important to consult with your doctor or pharmacist about how long to wait between doses and when to take your medications to avoid any potential interactions. Always keep a list of all the products you use and share it with your healthcare provider. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Pediatric Multivit No.175-Fluoride 0.5 mg iron 10 mg chewable tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It's important not to share this medication with others. It's always best to get your vitamins and minerals from food whenever possible. Make sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you're concerned about the fluoride content in your water supply, you can check with your local town or city officials. Fluoride supplements may not be necessary if the fluoride content in the water supply is greater than 0.6 parts per million. However, if there's a change in your water supply, it's best to consult with your doctor or dentist to determine if extra fluoride is still needed. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take a double dose to make up for the missed one. When it comes to the Pediatric Multivit No.175-Fluoride 0.5 mg iron 10 mg chewable tablet, it's important to store it at room temperature, away from heat and moisture. Remember not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. As for the daily dosage and timing, it's best to follow the instructions provided by your healthcare provider or the product label. Typically, this chewable tablet is taken once daily, and the optimal timing may vary depending on individual needs and preferences. Be sure to discuss the best timing for taking this medication with your healthcare provider to ensure it meets your specific requirements. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.